Hi, everybody. Welcome. I want to talk to you a little bit today about the brain and how prejudiced the brain is. And I want to talk to you about this in honor of Black Maternal Health Week, which is beginning today. And this is a topic that's very close to my heart. Many of you know that I lost my own mother at birth, and my mother's death was entirely preventable, as are the deaths of up to 80% of women of color who, especially Black and Brown mothers, who give birth and pass away in the process of giving birth or immediately thereafter. So I know it's a hard topic to hear about. It's a hard topic to talk about. It's a hard topic to live. Trust me, that's the hardest part. But it's really important for us to talk about because up to 80% of maternal deaths are preventable. And it's what stops us from finding solutions is the fear of talking about it, because of the fear of having to talk about implicit bias and discrimination. And so I want to start by saying that your brain is prejudiced and my brain is prejudiced. Okay. By the way, our Skyita is here with me. So she's only 5 months old, so she's still kind of all over the place. Say hi, Skyita. Um, so the human brain is prejudiced, and that is a natural fact that cannot be denied, even though it's very hard to hear. And people often feel really defensive when they hear some mamacita stop, when they hear someone say that something happens because of a prejudice or an implicit bias. So let me help you to understand this. And this is not from my opinion. This is at 100% from science. Our brain evolved for the primary purpose of our safety and our survival. Secondary to that, our brain evolved to help us reproduce. And that's why, oh my gosh, she's a little out of control, you guys. Let's see if I can get her to calm down a little bit here. What's happening, Kahita? Hold on, everybody. So let's see if she'll calm down a little if I hold her. Maybe, maybe not. Okay. So what's important to know, secondary to safety and survival, the brain evolved to ensure the survival of the species. So first it's the survival of the person, and then it's the survival of the species, right? So when we are living in a state of stress and emergency and survival, we are in opposition to the energy of creation. That you learn that all the time in the trimester protocol, right? So many aspects of the trimester protocol are designed to get the central nervous system and the hypothalamic pituitary adrenocortical axis out of a state of fight or flight or freeze, so that these resources are freed up to be funneled to reproduction. Because when the brain knows that we're safe and that we're going to survive, then the brain can prioritize reproduction. So this beautiful, elegant brain developed to ensure our safety and our survival. And that means it puts safety and survival above and beyond reproduction and everything else. And one of the ways that the brain ensures our safety and our survival is to use something called schema. Schema are mental shortcuts. And we use mental shortcuts so that we can make decisions very quickly. Because if you think about it, there's a lot of information coming at us all the time, especially in the world that we live in today, with billboards and pings and dings and social media and life happening in front of us where we're planted. But throughout history, we still have had, even before the sensory overload that we live in our modern world, we've still had to be able to take in a lot of information at once and make very quick decisions when our safety and our survival are concerned. So our brain uses schema or mental shortcuts to help us take in information very quickly and react and respond very quickly and make decisions very quickly. One of those mental shortcuts or schema that the brain uses is to distinguish between us and them. And the brain uses the distinction of us and them in many ways, but one of the primary ways is through racial and ethnic and religious and national cues, as well as socioeconomic cues, especially the ones that the ones that the brain can perceive. So you can kind of see them, right? So you see me and you see the clue of my hair, which indicates I'm probably a person of color. You see the cue of my skin, and you can see that I'm probably a person of color, whether you're conscious of it or not, right? Your brain is taking in that information. So in the time of our ancestors, when we encountered an other, so remember, us versus them, that's a primary schema or mental shortcut that the brain uses to keep us safe. That mental shortcut is very outdated because it doesn't really work very well in the world that we live in today, because look at us, we're all different, and it's a beautiful thing, and most of us love and celebrate that, right? But our brains still, just like our entire fertility and pregnancy system, still function today in the way that they were designed to function in the time of our caveman and woman ancestors. So think back to that time. In that time, if you saw someone who was an other, who was racially, ethnically, nationally, religiously different from you, that signaled danger, because people lived in tribes, and people's tribes did not usually interact with foreign tribes because of physical distance and how we weren't interconnected in the way that we are today. So if you saw someone different, if you saw an other, that sounded an alarm. It signaled danger. Were you being invaded? Were you being conquered? Was it war? Were they bringing disease? Were they going to take something from your what you've established there? And when I say bringing disease, because each group of people had its own diseases, and anytime peoples came into contact with one another, they spread what they had to each other and didn't have the resistance. And so it took the people who were being exposed for the first time out. I mean, think about what we have experienced in just the last 4 years, and you kind of get a glimpse of what I'm talking about. So that otherness signaled danger. And more than likely, there was danger if you saw an other at that time. But today, that's not the case, but the brain still functions that way. So the brain still uses that mental shortcut and has prejudices. It has biases, whether we're consciously aware of them or not. Most of us are not consciously aware of them. And those biases and prejudices that we don't even realize are operating below the surface of conscious awareness are affecting decisions that we make in the moment. Remember, that was the whole point of the schema, that they help us make quick decisions and take in information and use it. They affect the decisions that are being made. Well, how does this apply to 80% of maternal deaths being preventable? Well, here's the thing. Doctors are human, and they too have prejudiced brains, and they too are operating from schema, and they too are taking in information and having to make decisions quickly. And when it comes to labor and delivery decisions, the decisions have to be made so fast. A few seconds, a few minutes can be a matter of life or death. And so what's happening is that the decisions that are being made are being adversely affected by these prejudices and biases, and that is contributing to these deaths occurring, and to the majority of the deaths being preventable. So what I want to talk about today, even though I know it's hard, is to give all of us a way to support all mothers. And if you're a healthcare provider in any way, this is a wonderful tool for you. And by the way, we have an incredible evidence-based resource called Color Me Mommy that we designed for all labor and delivery and postpartum wards for all of the hospitals in America. And if you would like one for your hospital, for your station, just email us at support@fertilitypregnancy.org, and we will make sure that you have access to that for free. Okay. So here's what we need to do. What we want to do is we want to cultivate an environment of allied advocacy for Black mamas and all mamas and all mamas of color, as well as an environment of cultural competency and humility for healthcare and wellness leaders. That's number one. Number two, this is really important, and it helps to counteract those implicitly biased and prejudiced schema that I was talking about. We want to humanize Black, brown, and all mamas and babies to the prejudiced brain so that we can override the brain's natural tendency toward implicit bias and its devastating and life-threatening moment to moment decision making and the effects of those decisions. Okay. And then the third thing is that we want to provide a system of checks and balances that Black and brown and all mamas and healthcare and wellness leaders can use in collaboration with one another to ensure healthy, happy, successful outcomes for fertility, pregnancy, birth, postpartum, and for child development in early life and throughout the life course. Okay, so those really are our three goals. Let me give you some really important statistics that you may not know about. I'll give you a few categories: women's fertility and infertility, women's health and mortality in pregnancy, birth, and postpartum, and then some explanations for what's happening. And again, you already understand the implicit bias and the prejudiced brain, which accounts at a higher level for most of what's happening. But I'm going to give you some specific points on that, and then we'll wrap up for today. Okay. So Black women are nearly twice as likely to experience infertility or fertility challenges, as we refer to them at FPI, compared to white or Caucasian women, with a prevalence of 19.2% in Black women versus 11.8% in white women. That's according to the CDC. Black women are less likely to receive fertility care compared to white women. And a study found that only 8% of Black women received infertility treatment compared to 15% of Caucasian women or white women. Black women who, this is going to really shock you. Black women who receive fertility care are less likely to be successful in their fertility care and treatment. And the success rate of IVF is lower for Black women, with a live birth rate of 23% compared to 32%, according to ASRM. And by the way, both 23% and 32% are very low. And so you've got to be primestering before you go into IVF, because you've got to give yourself the best odds of success. It's an expensive endeavor to have a failed IVF cycle, and it's an incredibly expensive endeavor to have 5 or 6 failed IVF cycles, as many women do. Okay. So, despite these facts, the popular stereotypes of Black women and other women of color as being hyper fertile, having so many kids, persists. And these aren't just stereotypes that we see on TV, they operate in real life and in medical settings too. A 2015 review showed that medical residents, these are people who are one step away from becoming doctors, and medical students hold implicit biases toward Black women, and they rate them as more fertile than Caucasian or white women, even though you've just heard the exact data on how that's absolutely not true. That Black women are more likely to suffer from fertility challenges, less likely to receive fertility treatment, and less likely to succeed and be successful in fertility treatment. So these are our medical professionals in training who are not just holding these prejudicial beliefs, remember, because that's how the brain works, but they're also reporting them, and they should be educated about the reality, but still those prejudicial beliefs, they rise to the surface even in the face of education. That the brain and those shortcuts are so powerful. So in the United States, the infant and mortality rate and the maternal mortality rate among Blacks resemble that of a third world country or developing world. So the United States has the highest maternal mortality rate of any developed country, which is largely driven by Black mothers, by the way. Black mothers are 2 to 3 times more likely to die during pregnancy, birth, and the postpartum period. In the United States, we have the highest infant mortality rate of any developed nation. And once again, this is largely driven by mortality among Black infants. Black infants are 2 to 3 times more likely to die before their first birthday. I mean, I I've been doing research on these topics for 30 years, and it still takes my breath away, and not in a good way. It's so hard. Our Black infants are 2 to 3 times more likely to die before their first birthday. And here's what's really important to know, that it might be it might be natural or easy to assume that these statistics are the result of socioeconomic status or class, but actually it's not true. Black women with a college education are even more likely than Black women with a high school education to have adverse fertility, pregnancy, and birth outcomes. And we, the scientific community, believe that this has to do with the fact that more highly educated Black women and more upwardly mobile Black women are actually subjected to more racism and discrimination and implicit bias and microaggressions, because they occupy spaces in which they experience these things even more than the average person. And as a woman, the first woman of color in history on the tenure track at the Davis School at the University of Southern California, I can tell you from firsthand experience that is the truth. I was subjected to a more than decade-long brutal hazing, and yeah, it's so we know we have many lines of data like this that show us that it's not an issue of social class, even though many people will draw that conclusion. And the last thing I want to say is, remember how I told you that Black infants are 2 to 3 times more likely to die before their first birthday? Well, a 2020 study conducted by researchers at the University of Minnesota showed that Black infants are 3 times less likely to die if they have a Black doctor versus a white doctor attending to them. So this again shows us, number one, it's not an issue of social class, but also calm down, Skaita, but also that that these deaths are preventable, and that there are these implicit biases at work. So it's easy to resist, Skyita, she's so nippy today. It's easier to resist having this knowledge because it's uncomfortable. When we know it's not our fault, it's just part of how our human brain works, and then we know how the brain gets tripped up or locked into patterns that aren't helpful to individuals or society, then we can actively counteract them. So that's why I wanted to come and share. Skyita, what are you doing? Come and share this information with you today as we open Black Maternal Health Week. Let us know if you have any questions. No question is off limits. Don't be ashamed to ask questions. Don't be bashful. Don't be afraid. These conversations are important for us to have, and we have to feel safe having them. You're safe having them here. And if you would like our color, Mima, Skayita down. Sit, 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 Skaya, sit. If you would like to have, clearly I'm not going to let her come with me on my lives anymore. If you would like to have our Color Me Mommy resource, if you work in a hospital or a doctor's office, if you're a wellness professional yourself, please email us at support@fertilitypregnancy.org, and we will get you this resource for free that can save lives. It does save lives. It will save lives. Please be sure to spread the word to all of your colleagues who work in hospitals and have contact with mamas and their babies. And I send you off with warmest wishes. And I'm sprinkling super baby dust in your direction. I have some really strong and important and evidence-based thoughts on the decision that has taken effect this week in Arizona. And I will be sharing some information and resources on that as well in the coming days. I will see you soon. Have a great rest of the day. Happy Black Maternal Health Week. Deepak Chopra, who is one of my favorite teachers, says that at a molecular and spiritual level, we are all one and the same. And so when I succeed, you succeed. And when you succeed, I succeed. And I really believe that with all my heart, that regardless of the ways in which we look different on the surface, we are all one and the same. And when we are all safe, then we all have the much greater odds of living a beautiful life. And that is what I want for you and your super babies, and for every mama and her super babies worldwide. I send you off with super baby dust, and I look forward to being of service in this conversation. Today, I want to honor and send extra special love to my mama Miriam, who gave her life so that I could have mine. And I wish the doctors could have made better decisions for her so that she wouldn't have lost her life at 27 years old, and so that I wouldn't have had to figure out how to live life without so much as a mother propping me up. That's real. That's really hard. Even very recently, I really needed my mom, and I was thinking to myself, there's never a day when you don't need your mom, even when you've never had a mom, even when you are the mom of three super babies, even when you're approaching 50 years of age, you're half a century old practically. You always need your mom. So we need mamas to be alive, and we need them to be safe. We need them to be supported. So thank you for being here. Thank you for your loving, generous, curious dialogue, and let us know how we can support you in the hospital that you work in and whatever setting, medical and health setting that you work in. I'll be back to see you soon. Let me sign off here. So much love. And thank you so much for all this love.